And this is the data that I mentioned that we have from post-mortem studies suggesting that isolated cardiac amyloidosis in older patients is quite common. First, it was published. The first report was published in Germany by Soik in 1876, and then more extensive reports were published as early as in '65. So this is sort of the summary of this report. So we know from these studies that isolated atrial amyloidosis first appears in the third decade of life, and its prevalence increases in a linear fashion by 15 to 20% with each subsequent decade. And if we take patients, even not necessarily patients, normal people who died at age 90 or over, up to 90% of these subjects will have evidence of isolated cardiac amyloidosis. We also know that it's more common in women, and for this form of amyloidosis, the main precursor immunohistochemically is atrial natriuretic factor. So this is the paper published in 1965. It's from one of British hospitals. So the author of this paper, I think, probably was a pathologist. So she was surprised when she performed all this autopsy and found such a high prevalence of isolated cardiac amyloidosis in people who died in hospital from various conditions. And when she went back and looked at the clinical records of these patients, she found that more than half of them had heart failure, but not in one of these patients this amyloidosis was recognized. So more recently, we've now received some data from antemortem studies. So these studies, obviously they're limited. They were performed on patients undergoing cardiac surgery for various reasons, like bypass surgery, coronary arteries, or valvular surgery. So at the time of the surgery, the surgeons removed the samples from the left and right atrial appendices, and then performed morphological analysis. And they found again that this isolated atrial amyloidosis was extremely common in patients with cardiac disease, and it correlated strongly with age and other things such as PVA duration, left atrial size, and importantly the presence of persistent atrial fibrillation. Again, it was more common in women. So just a quick summary. So we think that this age-related isolated atrial amyloidosis, we think that it's very common. Well, at least according to the data that we have, it closely correlates with age. Its substrate is ANF based, and obviously its pathophysiological and clinical role remains to be established, and it could also be potentially targeted as part of future treatment of age-related amyloidosis. But more evidence is clearly required. That's what we're trying to acquire at our department. It is challenging because we cannot obtain histological evidence ante-mortem. And we're trying to look at this evidence in a much broader patient populations, particularly in patients with diastolic heart failure with and without atrial fibrillation, and also in some normal older subjects without evidence of cardiac disease. And we hope that cardiac MRI with delayed gadolinium enhancement is a new technique that's going to help us. Just an illustration how it works. So these are all MRI images of the heart, and these images at the bottom, this image is performed 10 to 15 minutes after an injection of gadolinium-based contrast. And these bright areas of delayed gadolinium enhancement indicated by arrows. So these areas correspond very well to the areas of amyloid infiltration. So, and this is sort of a proposed positive feedback loop where we think we should incorporate this atrial amyloid deposition. So what happens in aging and in age-related cardiac disease? Obviously, the left atrium undergoes our hemodynamic overload and some remodeling. Inevitably, we have increased ANP release, and somehow part of this ANP then deposits in the left atrium in the form of atrial amyloid, which can lead to further impairment of atrial architecture and function with frequent development of atrial fibrillation. And So this is an important contributing factors to the development of diastolic heart failure. Is it treatable? At the moment, I think the answer is no, although we've just heard from Mark Purkis a few examples of new potential anti-amyloid drugs that may be available in the future. So at the moment, how we treat cardiac amyloidosis, it's only supported treatment, it's standard heart failure, although it's not particularly effective, so we can insert a pacemaker in some cases. And obviously there are radical measures such as heart transplantation or liver transplantation that is used in some patients with severe hereditary forms, ATTR forms of amyloid. And we have hope for future availability of anti-amyloid compounds. So we believe that cardiac senile amyloidosis and isolated atrial amyloidosis could be potentially clinically very important, because the role of amyloid-related toxicity in many age-related chronic degenerative diseases is now strongly suspected. Perhaps not entirely proven, but strongly suspected. So we have this Alzheimer's disease with 30 million of people, patients worldwide. We have diabetes with more than 150 million sufferers worldwide. So if proven that this senile cardiac amyloidosis or isolated atrial amyloidosis is indeed a major factor in the pathophysiology of diastolic heart failure, it could be of similar clinical importance, because we may have potentially 20 million of people suffering from this condition worldwide. And therapies aimed at inhibition of aggregation of amyloid fibrils could potentially be effective in this condition, like in other forms of amyloid. So I think that's it. I'm finishing here. Thank you very much.